Now let's come to what happens if you manage to get pregnant before correcting your insulin resistance. Like the previous video in which you're just trying to get pregnant with insulin resistance. By that I mean your periods are not regulated, you've not corrected the way you eat, you're still overweight or obese, and you've gotten your treatment to get pregnant. And if you've managed to get pregnant without correcting your insulin resistance, wherein you are not having like a diabetic diet, sort of, not, I wouldn't even recommend diabetic diet, but just if you're not having a very low glycemic index diet, and you have not lost your weight, there is possibility that you still have insulin resistance, and if you have gotten pregnant with it, you are at risk of so many complications. Now ectopic pregnancy, if you remember, I showed you that all the abnormal places where you can get pregnant, like the pregnancy can stick, those are called ectopic pregnancies, and the most common places are tubes. That is very common with fertility treatment, not just for PCOS, but any sort of ovulation induction or any sort of fertility treatment. Because what happens is, with ovulation induction, not just for PCOS, for anyone who is getting fertility treatment done, we are giving these medications for you to get pregnant, and then multiple eggs are forming, and these all eggs are waiting in the tubes. So they get released and the tubes go and catch them, and the sperm will reach there and the babies are forming in the tube. And sometimes these babies get stuck in the tube because already there was a problem. There's some slow motility in the tubes. The hormones that we are giving, which sort of reduces the motility of the tubes. Sometimes the tubes are damaged because of endometriosis or genital tuberculosis or some surgeries in the past. So all of these factors can be contributing along with the medication that you're taking. So for PCOS specifically, like if we assume that everything else is good for you and PCOS is the only thing, this is something which is completely avoidable, right? Because if you are PCOS and you lose weight and you get pregnant naturally, the chances of you taking ovulation induction medication and making lots of babies and getting ectopic are way lesser than you taking ovulation induction medication, making lots of babies, and the babies getting stuck in tubes. Sometimes one baby will come and stick in the uterus and the other one will be outside. We have had, that's called a heterotropic pregnancy. That complication can happen. And ectopic pregnancies cannot survive. We cannot push the baby back inside the uterus. Once it sticks outside, the outcome of that pregnancy is either we give you a medication. If it's just one pregnancy, we give you this medication which might work. It's a painful injection. Like the injection itself is not that painful, but when the pregnancy is sort of melting and dissolving inside, that's painful. And that again demands a lot of blood tests. I mean, if you are someone you're okay with needles, that's fine. But if you don't like needles, lots of needles. I mean, literally, the blood test sometimes is done every 48 hours, sometimes every day. Sometimes we keep you in the hospital with a cannula in, and then you will be monitored regularly. That's ectopic pregnancy for you. Apart from this, there is first trimester miscarriage, which is basically you got pregnant, the pregnancy got stuck in the uterus, but this baby did not grow. It's like a blighted ovum or like an miscarriage, wherein the baby was there, we could even see the heartbeat, or sometimes we don't even see the heartbeat, or we saw the heartbeat and then it disappeared. Now this is not necessarily because of insulin resistance, but again, because of insulin resistance, because there is something wrong, the chances of you having miscarriages are slightly higher. Also, if you take the fertility treatment, abnormal eggs are coming out. Like naturally, nature selects only one egg. But when we give medication, we make lots of eggs. Some of them are not necessarily good. So we are sort of cheating the system, right? So the chances of miscarriages are always higher with fertility treatment. Even second trimester miscarriages. This is like agonizing because you saw the baby's heartbeat. The baby is grown into a small, like a fish. It's like a tadpole inside. You see everything, and then suddenly one fine day at 15, 16 weeks, you start leaking. Suddenly water is coming out or blood is coming out and you miscarry the baby. Some patients don't miscarry, they just keep leaking, especially for those who have had IVFs or those who have a lot of insulin resistance, because they have a risk of having infection inside. they are more prone to infections, and once they start leaking, that bag, that immunity for the baby is compromised, and once that immunity is compromised, then your baby, chances of you miscarrying are very high. And depending on which country you live in, the treatment changes, because somewhere like India, where we have a liberal termination of pregnancy act, you will be offered a termination of pregnancy because your life is at risk, because that infection is now to your uterus and it can kill you, kill the mother. Whereas in a country like UAE or any Muslim country or anywhere where the abortion law is very strict, they will balance it out. They will keep monitoring the mother to see if she's in danger at any point, but they will always try to rescue the baby. If the baby is alive, we cannot touch the baby. Right? So it's a very complicated ethical situation as well as medical problem. So there is that risk also, which is very high. The viability age of babies to survive inside is generally after 24 to 28 weeks. Like even if your baby manages to come out at 24 weeks and if you have excellent NICU facilities, still the baby is going to be at risk of a lot of complications. So there is that, and then there is the risk of OHSS. Again, some patients get pregnant and then they have OHSS, especially with Clomid or letrozole, because then there was no way to know whether they're getting pregnant. If the doctor is doing IVF, they withhold the transplant or implantation of embryos. But if you have had OHSS and you've done Clomid induction, which was just your tablets, the doctor has not monitored you much and you responded aggressively, chances of you getting ovarian hyperstimulation are higher. Apart from this, twins, triplets, quadruplets, some patients, they think that, this is like one-time thing, right? Once you have twins, then you don't have to worry about it. But it's a highly complicated pregnancy throughout 9 months. And I can't even imagine what goes on when it comes to raising these kids, because then you have dual issues. And it's like so many patients who have twins, they conceive again after naturally, and then they have a third one. And I mean, it's just you're making so much effort for yourself, that is afterwards. But even during 9 months, it's not an easy pregnancy. It's not supposed, twins are abnormal pregnancies. You're not supposed to have twins. It's complicated throughout from the get-go. All right, then there are preterm deliveries, which can happen with insulin resistance because you are at risk of infections so much. So chances of your uterus bag, bacterial vaginosis, infections in the urine, infections in the vagina, infection of the, especially if you have leaked, all these are at risk of preterm deliveries. Pregnancy diabetes, this is another chapter altogether, and I'm going to make a video on that as well. I want you to see that, to understand that when you get pregnant without correcting insulin resistance, you are at risk of getting pregnancy diabetes as well. I'm not saying that the risk reduces if you correct it and you get pregnant. Chances are your GTT might still be higher, but if you have figured out how to manage your eating before you get pregnant, then it's like smooth sailing in pregnancy. Bleeding during pregnancy, this is called antepartum hemorrhage. This is very common, especially if you have done IVF, because we have gone inside, manipulated things, so things are sore. Sometimes placentas get implanted lower. There can be placenta previa during delivery, because your babies, especially if you're a diabetic baby, uterus is big. Chances of you getting postpartum hemorrhage is bigger, more. If the water on the baby is bigger, more, because the uterus is expanded so big, it doesn't contract so well, and then you keep bleeding. And after delivery also, the risk of you getting bleeding because of infection of the uterus lining, that can happen because of insulin resistance. Type 2 diabetes patients, GDM patients is common. Infections, bacterial and fungal infections. Fungal infections, bacterial is recurrent urinary tract infections are common, but fungal infection is a menace. It's not just the vaginal infection. It's after delivery. When you get vaginal infection after delivery, it's not like something which can cause you big harm, but it's treatable, it's irritating, but after delivery it can happen in your breast, and that's painful, very, very painful. It's like sharp needles and knives you'll feel like when the milk is coming out. That's because there's fungal infection of the nipple. So all of this is because of diabetes. I really, really wish I knew about it, that I could correct that, because I suffered a lot with it, and I really wish that you don't have to suffer through it. So learn how to reduce your insulin resistance. Complicated deliveries. Remember, if you have diabetes in pregnancies, IVF, chances of you getting induced early in labor or early in your pregnancy are higher. When you are getting induced, chances of you having complicated labor and delivery, constant monitoring, cesarean sections will be higher, recovery will be longer. All of this can be avoided if you decide to lose weight before you get pregnant.